Hi everybody, and welcome to the Portsmouth City Council and the News COVID-19 Ask the Panel event. Really delighted to have you here this evening. My name's Hayley and I work at Portsmouth City Council. You may notice that I am not Mark Waldron, editor of the News, who was supposed to be hosting this evening's event. But unfortunately we had some technical difficulties, and I am in the driving seat tonight. But it's a real pleasure to be here. Really pleased to have you here. We had a lot of people sign up to the event, a lot of questions, so thank you to everybody who submitted questions. We're going to get through as many of them this evening as we can. I'm really delighted to be joined by our panel this evening, and I'd like to introduce you to them all. So we are joined by Helen Atkinson, Director of Public Health at Portsmouth City Council, Angela Anderson, who is the Clinical Director for the COVID-19 vaccination programme at Solent NHS Trust, Councillor Matthew Winnington, Cabinet Member for Health, Wellbeing and Social Care and a Mental Health Champion at Portsmouth City Council, Dr Abu Mohammed, a local Portsmouth GP with the NHS, and Superintendent Claire Jenkins from Hampshire Constabulary, who has responsibility for the whole of Portsmouth. So welcome to our panellists this evening, and welcome to you as our guests. I don't think any of us probably thought a year ago in March that what we would be going into in terms of probably the hardest year in our lifetime for the country, for the world, a global pandemic, but we're in it, and actually, you know, we saw tonight as an opportunity to gather our thoughts, get some questions from the residents of Portsmouth and have the opportunity to answer those questions and engage with you all. So thank you again. And so really, we just want to dive straight in to the questions because we've got a lot to get through. We're going to be here for an hour. If we don't answer your question this evening, but you did submit a question, we will get back to you by email. So if your question doesn't get answered, please don't feel disheartened. We will get back to you. So let's dive straight in. And the first question is about the current situation in Portsmouth. And this question came from Anne Stevens. Can you give a current perspective on how well Portsmouth is doing in terms of infection rates and how the QA hospital is faring? And I'm going to hand straight over to Helen Atkinson to answer our first question.
Thank you, Hayley. So, as you'll all be aware from the news, we are coming out of the second wave of the pandemic, and currently in Portsmouth today we have 190 cases, that new confirmed cases of COVID-19 in the last 7 days, which is 77 less than a week ago, really. So it is definitely reducing in terms of our infection rate. That puts us at a rate of 88.4 per 100,000, which is 29% reduction from last week. And just to give a comparator, so currently the England average is 91.4, so we are actually below the England average. But I don't want us to be complacent, because it's fair to say that this is still quite a high infection rate. We are all coming down across the country now, but it still is quite high, so we mustn't be too complacent, particularly need to follow all of the measures we've been asked to follow in terms of hands, face, space, but it is definitely an improving picture. And I'd like to introduce you to Dr. Mohammed, who is going to talk about the QA.
There we go. Thanks so much for that introduction. So I'm Dr. Abu Mohammed. From a QA perspective, so since the start of the pandemic, there have been roughly 4,000 patients with COVID, sadly, that have gone through the hospital. And at present, there are 200 patients in the hospital with COVID. Sadly, 10% of those currently need mechanical ventilation. The really good thing is this number has been decreasing with time. So in the last 7 days, there have been 100 patients with COVID going in. And at the peak, there were 60 patients a day going in, whereas now it's roughly about 15. So the numbers are moving in the right direction, which is a good thing. And I've got colleagues, I'm a GP, but I've got colleagues that are currently working at the hospital, and everyone's doing their best for the patients, and it's positive to see that things are moving in that downward spiral as a result of all our efforts. So well done to everybody.
Thank you, Dr. Mohammed. Yeah, I think it's really, really encouraging to see that the numbers are heading in the right direction. I guess the mutations of the virus are something that a lot of people are talking about now, and Susan Sparrow asked a question specifically about this, and whether the mutations of the virus is something that will be with us forever. And Councillor Matthew Winnington, you're going to come in on this one.
Yes, thank you, Hayley, and thank you, Susan, for your question. It's a very, very pertinent one, and it's one that lots of people have concerns about. So the quick answer is yes, but all is not necessarily a bad thing or anything unusual, because actually for any kind of virus you get variations and you get mutations all the time. So, for example, for the flu vaccine that we have, which goes out to people every year, that is ongoing. That there's research into that, and it's renewed and changed every year because the strains of the mutations of flu go on every year, and that's exactly the same as will happen with COVID. But the really important point is all the mutations and variants of COVID-19 we've had so far, the vaccines that we have at the moment work with those variants and those mutations. So that's really good news. So it's just the reality of any virus that is out there in our community. It's just what happens. Viruses mutate, but the vaccine and the research will always be there, and will always be there to keep up. At the moment, we're all fine because the vaccines work with all the variants as far that are out there at the moment, and in the future, any vaccines we need in the future will be developed to make sure they can keep up with those variants as well.
Thank you, Councillor Winnington. And actually, I guess whichever variation of COVID you may get, one of the questions is around how do you know when you've got COVID, and how do you know when you're clear of COVID? And this is a question that's come through from Doreen Caddock. So if you've been diagnosed positive, how do you actually know when you're clear of COVID? And Dr. Mohammed, you're going to come in on that one for us.
Yeah, that's a really good question, actually. So nothing is 100%. Very few things are 100% with COVID, and so what we need to do is just follow the national advice, and that is to make sure you're sticking to the self-isolation advice that you've been provided. So the first thing is there are a couple of ways to find out that you're positive. You may have had a lateral flow test at work, in which case you wouldn't have had any symptoms and you need to be self-isolating. If you then develop symptoms while you're self-isolating as a result of your lateral flow test, you then need to extend that self-isolation period for 10 days from when your symptoms start. And the key thing is to make sure you're not breaking self-isolation if you've have an ongoing symptom such as a temperature, runny nose or sneezing, diarrhea, or feeling sick. And a lot of this information can be difficult to remember, so always just check back on the NHS website because things are always updating regularly. All right, so there isn't a test necessarily that we do to make sure that people don't have ongoing COVID. We stick to the self-isolation process, and if you're fortunate enough to have access to the lateral flow testing, then again, that's going to be an ongoing reassurance that you're no longer infective to others. I hope that answers the question.
It does, and it really shows the importance, the ongoing importance of testing, I think, doesn't it? I think we might be thinking that as the cases are going down, that it is a positive outlook at the moment, and it absolutely is, but I think there's still a really important part that testing will continue to play. So thank you for that. And actually it kind of ties in quite nicely to the next question, which is all about long COVID, because unfortunately there are some people who contract COVID who will still have some ongoing symptoms and what is become known as long COVID. So I wonder, do you know what percentage of people are suffering from long COVID, Dr. Mohammed? And how do you know if you are?
Yeah, of course. Again, another very good question. So from the surveys that are being done, about 20, so let's define long COVID to start off with. So long COVID is if you've got COVID symptoms that are going on for more than 4 weeks, okay? And when we survey people, this is just sort of research data, when we ask people whether they've still got their COVID symptoms, about 20% of them have still got symptoms at 5 weeks or more, okay? So by definition, they will have long COVID. Now, just because you've got long COVID doesn't mean that you necessarily can't go out, go shopping, go to work. It affects different people in different ways. So yes, there is severe long COVID, and if you are suffering with those symptoms, definitely get in touch with myself as a GP, and we'll provide you with the support that you need. But equally, if you feel that your long COVID symptoms are mild, whether that's your smell hasn't 100% come back to normal, or your energy levels aren't 100%, then it may well just be that you need a little bit more time. And then moving forward, about 10% of people, so 1 in 10 people, still have some COVID symptom or another at 12 weeks or beyond. So that's the definition of long COVID, having COVID symptoms beyond 4 weeks, of which there's a wide spectrum. It could be very mild, or it can be, sadly for some people, quite severe as well.
Thank you, Dr. Mohammed. And I guess having long COVID, as well as the physical symptoms, actually can have a real impact on people's mental health. And I guess just the pandemic in general has very much had this effect. And Councillor Winnington, you're one of our mental health champions at Portsmouth City Council. What is being done or can be done to address people's mental health?
Thank you. Yes, a really important part of this to start with is understanding how what impacts that, not just the pandemic, but also particularly long COVID, as we've just been talking about, that can have on people's mental health. So it's just to reassure people watching that that there's lots of research going on around this, lots of people who have got long COVID getting involved, and of course there's lots of discussions for people who are open to sharing their experiences about how their mental health has been in the during the pandemic. So that's nationwide, but also here in Portsmouth, that's been going on. In terms of what we're doing in Portsmouth for the support for mental health, we've actually, during the pandemic, so this was back in late spring last year, a mental health alliance was actually started off for the city, and that brings together mental health organisations, the City Council, the NHS, but also businesses, the voluntary and community sector, and education establishments as well, to really put that concentration on what we can do to support people who are suffering from poor mental health, or people who might be at risk of that, and also for people who are supporting people who've got mental health issues, and also, of course, because what the pandemic has done, it's made a lot of people who've never experienced mental health issues in their lives before. It's had that real impact because people have been isolated, etc. So what it's also looking well, and this is a really big part of the support that everyone in the city is pulling together, is what are the things that can lead on to poor mental health, so to try and stop people getting there in the first place. So that's a really key part of the work of the Mental Health Alliance, but also as we put in our budget going forward at the City Council, to make sure that we have those the underlying base funding there to make sure that mental health services, the council funds and the council supports are continued, and that we're not having to cut those back. So we've made that a real priority at the City Council, and we know how much of a priority it is for our partners, especially in the NHS and the voluntary community sector, to make sure that happens too. Because fundamentally, there's never been, I don't think mental health has ever been more, people have been more open about it, more understanding about it can affect anyone. So absolutely anyone can be affected by poor mental health. And so we have to, so by involving as many organisations as we can in supporting people with mental health issues, that really enables us to pull together as a city and really support each other. And I think that's, and I'd just like to thank everyone out there who's watching, who's been supporting people with mental health issues, or if you've had mental health issues as well yourself. I hope you've got support. If you haven't, please do contact the council, or there's places like Positive Minds, which is based right down in Somerstown in the city centre near Middle Street. There's always a place to go. If you want to talk anonymously, there's things like the Samaritans, who do a magnificent job, but there are people out there. Don't think you're on your own, don't think you're alone. There are there to help, and we're all pulling together to support people with any mental health issues at the moment.
Thank you, Councillor Winnington. Yeah, and if anybody is looking for any support and advice, if you search for mental health on the Portsmouth City Council website, there will be lots of relevant links on there as well. And I think just one thing that you touched upon there about mental health is spoken a lot more now, and actually for a lot of people, they may not have realised that they were experiencing poor mental health, and then something like loneliness, which a lot of people will have felt during the pandemic, has really come to light. And I think exactly what you said, Councillor Winnington, there is help out there, and I hope that for those of you who do need help, who want help, can find that in the city. So that actually leads me on quite nicely to when hopefully we can be out of lockdown again. The roadmap that was set out by Boris Johnson last week. I think we are all looking forward to those dates that were set out there. And Helen, I'd like to come to you really, and I guess just ask you, how likely is it that we're going to hit those milestones? How realistic is it?
Thank you, Kelly. Well, I think to a certain extent you can say that's depends on all of us. So I'd like to start by saying thank you to all of our residents. We've had incredibly good compliance over the whole of the pandemic in the last year, and it's really important that we maintain that now as we move forward with the 4 stages. Now, I recognise we've just been talking about mental health and emotional well-being, recognise how hard this has been. I mean, none of us in our lifetimes will have had to have dealt with anything like the lockdown that we've had throughout the 3 lockdowns actually we've had throughout the pandemic. So, of course, people are desperate to get back out, but ultimately it will be all of our behaviours and how we decide to act that will have the impact on whether we do come out. So we've got 4 stages of the release on the roadmap. The first being next Monday when schools go back. I should say actually schools are already back. In fact, they haven't not been back, important to say. So schools have been open for our most vulnerable children and for our key worker children, but this will be the first time since since December that they have all been attending, and it's going to be an important milestone. But I want to say initially, you know, we have seen the infection rate coming down considerably over the last 3 months that we've been locked down, because lockdowns do work. The reality is that the virus spreads person to person, and the more contact you have with the more people, the more likely the spread. And we will expect to see, as we come out of lockdown into the releasing, that we will expect to see an infection rate going up. Sadly, it's inevitable, and it will happen. However, if we can, and that's, I suppose, not get too excited, but still maintain all of the good preventative measures that we've been following. I mentioned them earlier, the hands face space, you know, wearing masks when we're in public places, trying to keep our social distancing, even if we are meeting up in each of those stages with the allowed number of people, it will make a huge difference. So each of those stages will, the next stage will follow 5 weeks later, and that is really so that government can look at a month's data. So the 4 weeks, first initial 4 weeks between each of the stages, where the data evidence will be pulled together, and then a week to make the decision whether the relaxation into the next phase can happen. So we've got these key dates. We've got 2 in March the 8th, and then on the 29th, when people will be able to go back to the rule of 6. I'm sure people haven't forgotten the rule of 6 outside. And then further dates in April, and then they're each a month, just over a month apart, the 17th of May and then 21st of June. So I'm asking, I suppose, that final ask is, this lockdown has been difficult for everybody. You know, I've struggled, everybody's struggled. We've just had a 3-month lockdown through winter, which is, you know, dark, cold days, dark nights, and I know that people, I think this has been the hardest of the 3 lockdowns. Obviously, last March, April, May into June, the weather was quite pleasant when we first went into lockdown, and it was obviously new to us. And then obviously we've had the month lockdown, the end of last year, and then the 3 months. So people are struggling, but it is up to us what will happen next, because if we can maintain and keep to the rules as best we can, then I do believe that each of those stages will be met. But if we don't follow the advice, and we do actually not follow the rules, and we do start meeting up with more people, the likelihood is the infection rate will go up, and I think we will then have delays to further lockdown. So it's really up to us. We do expect to see infection rates rising again. However, positive, which I know we'll be talking about later in the session, is the vaccination programme, which has been so successful, and there is good evidence that it will have an impact in terms of the infection rate. So the longer that we can follow the rules as we come into relaxation, I think then the vaccine will rollout will be pretty much complete, and we should hopefully be able to get back to some kind of new normal. I think there will be measures in place still for the rest of this year and possibly into next year, but maybe not to the same level as lockdown, hopefully. Thank you, Hayley.
Thank you, Helen. And Superintendent Claire Jenkins, I wonder if you wanted to come in on that at all, because I can appreciate that the roadmap has been set out, but actually as our local police force, that's something that you're probably keeping a very close eye on.
Absolutely. Yes, thank you. And Helen has just really articulated all of the unveiling, if you like, of that roadmap and all the interdependencies at every step of the way. So from a policing perspective, we're here really to support our health colleagues and to support the community in preventing the spread of the infection. And I would say that throughout the pandemic, we have played a supportive role in that. So I would reiterate the cautiousness, if you like, that we all need to take in terms of that gradual coming out of these restrictions that we've been in, and making sure that we all adhere to our part that we have to play in that by adhering to the current advice and guidance at every step of the way. I think it's quite tempting sometimes to think, well, it's not long until we can maybe move to the next stage. I would just probably emphasise, let's stick to exactly what we're being told at each stage to prevent, as far as we can, any further rise in that infection. And then, of course, it's more about when we can go out a little bit more, whether that be in the rule of 6 or whether we get to the stage where we can go into maybe a pub garden, and then onwards, and as we start to look forward to maybe some of those events that we're used to seeing in the city in the summer period, that it's just doing that sensibly and safely. I know we've all been cooped up for a really long time at home, with many people working from home, and all the issues that Councillor Winnington is rightfully covered as well around how people are feeling as a result of the last lockdown. But we want to be able to enjoy the new normal within the city, and I would just say do it safely and sensibly, and we will get there.
Absolutely. I think we are all very much looking forward to June, aren't we? And I hope that all of us as a city will do everything that we can now in order to make sure that June 21st date is a possibility. Some of the questions that we have had in are around what do we do now, and actually whether the police are still enforcing some of those rules that we know of. So Debbie commented that she'd seen a few people playing football, for example, quite a large group of people, and Mary had asked how far can she travel. She lives in PO2. She wanted to access some outdoor space, and was asking some questions around that. So Superintendent Jenkins, I wonder if I can actually come back to you and talk to you about how the police are currently enforcing the rules.
Yes, thank you. So in terms of our current enforcement, we're still taking the approach that we've had right from the start, which is to initially engage and explain and encourage people to follow the guidance and indeed the law. And then when we need to, we will resort to enforcement, which, as many of you will be aware, results in the issuing of fixed penalty notices and fines for those people that are breaching the guidance. To do that, we've worked really closely, in partnership, but also my local neighbourhood teams who know the areas and know the residents, have been out visibly patrolling, and we've been working with our colleagues from Portsmouth City Council also in respect of those patrols. So we can patrol, as you know, the large open spaces and the areas where we know people like to go and partake in their exercise, and we do that. But we're also, as you can imagine, interested in gatherings or parties that are happening behind closed doors, where indeed the spread of the infection is even more likely. So we follow up. We will deploy to as many of the calls as possible. In Portsmouth, our deployment rate's around 40%. That might sound low, but it's because some calls come in after the event, which obviously would mean we wouldn't deploy to those anyway. But what we do is daily scanning, so that we will look at repeat locations, repeat individuals that are being reported as breaching, and focus our attention very much on those. So that's the approach that we're currently taking. In respect of the second question around how far can I travel for my exercise, it is a tricky one because legally it's not defined, but the government guidance currently says that you should stay within your town or village or within the part of the city in which you reside. So, you know, the stay-at-home message is still relevant at the moment, and in fact, even when the children go back to school next week, the stay-at-home message still remains at least until the next consideration towards the end of March. So, whilst we know people are desperate to get out, and as the weather improves, I think it's really tempting to travel that bit further to avoid putting strain on services and to make sure that people are adhering to the guidance. We would say it's stay local is the best advice that I can give.
Thank you. And Councillor Winnington, I wonder if I can bring you in as well, because we've mentioned the seafront there and some of the green spaces, and I'm sure many of us will have seen how busy those areas have been. And I think it's also about the businesses in those areas as well, isn't it, and what we can do to help them. I didn't know if you just wanted to come in on that.
Yes, thank you, and thanks to both Debbie Mays and Mary Rawlins for your questions there. I think the important thing to say, and Superintendent Jenkins has just alluded to this, is about how we're working as a council in tandem with the police on this. So we have COVID compliance officers, and they are supporting particularly our businesses to make sure that they have compliance. So, for example, they went around every single food related establishment that's open for people throughout the pandemic to go food. So every single one of them was visited by the COVID compliance officers in a very supportive way, just to make sure that they were being compliant, and if they weren't sure or were maybe not going to the guidance, to support them to make sure that they could do things properly and in a way that was COVID safe. And more recently, they've been particularly working with businesses in sort of back rooms, so making sure that staff are safe as well. So well, staff have to be, they're making sure that those environments are safe for all staff. So it's very much a supportive way of doing it we've done in this city. I know other cities have done it, and other authorities have done it very differently. They've been more punitive, but I think with the police and the way we've done it here in Portsmouth, it's been a really supportive way of doing things, and we've had very low numbers of fines, etc., for businesses for non-compliance, because I think we've taken that very positive point of view and actually managed to get people supporting each other. In terms of public spaces, the seafront, etc., you might have seen in the news a few weeks ago about the drone we put up. So that's something that the council invested a bit of money to do that, to hire that and put that up, because that really gives a very clear, objective picture of what's going on, and so that can really pick out about, because sometimes perspective on the ground you might think it's much more busy than it is, but from above you can really see if issues with social distancing, and that's available to us to use as we need to. And obviously we're using support from the police and monitoring from the police, from our COVID compliance officers, from other council staff, and also the general public reporting in, just to understand where the issues might be, and where we can make sure that we're taking action as well. But what I would say is that actually the compliance among people in the city has been really rather good. Even going back to the summer when it was very, very busy and people around, actually lots of people, I went down there myself, down to the beach with my wife, and I have to say it was, everyone was in there, was keeping their social distance groups. They were in their groups together. That was allowed at the time. There were all the 6, but they were socially distancing from each other. And I think the reason the compliance about of people in the city, we know is being pretty much consistent right through. So we good compliance here compared to other places. So I would say, do make sure you take note of what the restrictions are any particular one time. If you see things that you're not sure about, do report it to the council, do report it to the police if you think that needs enforcement. We are taking it seriously. We are working hard across the organisation, but let's concentrate on what we can do and look out for the guidance what you can do, and don't think that it's about what you can't. I think it's a really positive thing. We've got good compliance in the city. We're all doing it for each other's benefits. So if we keep that up, then we can continue to have, that people can make the most of it, because we know as things loosen, as things get easier for people to do things, that's mental health before that's going to be good for people's mental health as well.
Thank you, Councillor Winnington. So our next question is from Fiona Rosen, and it's about when more children are returning to school from Monday, and actually a concern around spreading the virus, the safety of children and young people returning, and also a question around whether teachers will have received their vaccinations by that point. So I'd like to bring in Angela, but actually first of all we're going to go to Helen Atkinson. Helen, how safe is it for children and young people to be returning to school?
Thank you, Hayley, and that's a very, very good question. So we always knew, governments have always said that in the steps that they would bring back schools first. And we've been working with schools all throughout the last year of the pandemic. And can I just say that schools are very well prepared. We've seen this each time that they've been asked to step up and reintroduce children back into school. So we know that schools have been open throughout the period, but for less students. But they have very good risk assessments and plans in place with really good measures. School children and young people, all the pupils, will be tested ahead of going back to school with the lateral flow device tests that Dr. Mohammed mentioned earlier. And then we'll continue testing twice weekly, initially in schools, and schools have put their plans in ahead. Some are starting to, for those of you who've got children will be aware of this, some schools are starting to bring in their pupils earlier to start testing, but others will start from next week. And then schools will be moving to home testing for staff and pupils once they have done the first 3 tests. But also alongside testing, which, as Dr. Mohammed said earlier, is a really helpful preventative measure because it identifies if any staff or pupils have got coronavirus, and then obviously they can then return home or not come into school if they are doing home testing. So importantly, that self-isolation that Dr. Mohammed spoke about earlier is really important, because actually what we know is if we identify any possible cases and get staff self-isolated, take them out of the school, you'll get you won't get the infection spread. It's really important because we know you'll be aware possibly from the media that the current variant, which is spreading is the UK variant, and it is more infectious, so it is very transmissible. And we also know that 1 in 3 people who have the UK variant have no symptoms, so of course people might be at work, at school, spreading the virus without even knowing. So lots of other good, what we call infection prevention control measures in place in schools, including wearing face coverings, and that is staff and secondary school pupils, social distancing, and increased cleaning regime. So lots of measures already in place, and they really are. Schools are ready. They have shown that they can do this before when schools were back last summer after the first wave. It's also important to mention that if we look at, I have heard that people think that children are the big spreaders. It's interesting because actually, yes, that is possibly the case when we look at your annual colds and flus, but actually with coronavirus, since the beginning, if we look back, we've had some of the lowest rates. So if we look at all of our age groups, and we look at this data every week, it's actually our working age adults that have the highest infection rates, so our 30 to 59-year-olds. And actually, since the beginning, the 0 to 14-year-olds have had the lowest infection rate of all age groups. In fact, what we haven't seen is that infection rate going up in as we've had each of the waves or the surges. So we know that children aren't necessarily the ones that are actually catching and spreading the COVID-19. That's been backed up by both the Chief Medical Officer and the Deputy Chief Medical Officer, Dr. Jenny Harries, who have looked at the evidence and worked with SAGE, who, as you know, advise government. And the evidence is that schools are no high in terms of workplaces or settings are no higher risk than other workplace settings. And actually that's really important, because there's even Dr. Jenny Harries said recently that the spread of infection is more likely to be in adults in schools and possibly with staff, and actually we've seen it also, dare I say it, in other workplace settings. It's when our adults tend to forget, because we're all human, to remember to keep their face coverings on, or their PPE, personal protective equipment, and their distancing. So where we have seen outbreaks, it's often been in the staff, and often in staff rooms and other offices. So we really want to bring our children and young people back into the school setting. Pupils need to be at school. We can see the impact that it's had on our young people in Portsmouth, and in terms of both education, but also in terms of their mental health and emotional well-being. So it's really important that schools come back. And the other important fact is this is the first stage of our releasing the lockdown. So we need to move forward. We need to get our school children back at school, and then we can hopefully start to move into the other relaxations of the lockdown. Thank you, Hayley.
Thank you, Helen. And you mentioned there that actually it might not be the children and young people who will be spreading coronavirus. Actually, it may more likely be the staff and adults. And that was probably part of the question as well from Fiona. And she sort of asked about teachers and vaccinations. And it seems pertinent to bring Angela in at this stage. Angela, we haven't spoken to you yet, but in your role as clinical director for the vaccination programme at Solent NHS, I'm wondering if you can come in and just talk about, are teachers receiving the vaccination, or when will they be receiving the vaccination?
Yeah, thank you, Hayley, and thank you everybody for giving me the opportunity to be part of the discussion tonight. And Fiona, your question is very dear to my heart, as I have teachers in my family. So a very pertinent question for me. I think what's really important to understand about the vaccination programme is that its aim is to get as many people vaccinated as quickly as possible, but critically that we vaccinate as a priority those at highest risk if they are to catch COVID-19. And all of the evidence considered by the Joint Committee on Vaccination and Immunisations has clearly shown that the highest risk groups are the elderly population and those with significant underlying medical conditions in a range of ages. So the vaccination programme is very targeted at those groups and working through the priority groups. So I think we have to acknowledge that whilst teachers specifically aren't in those groups, clearly some teachers will already have been vaccinated because they fit into the eligibility criteria. I think the other important thing to note is the vaccination programme is being rolled out at pace, and we are now down to the priority 7 groups, which is the over 60s, and we are moving very rapidly over the next few weeks into the next 2 priority groups, which will be the over 55s and the over 50s, and then moving down through the age groups. So clearly within some of those eligibility criteria, we will also have teachers included. But I think it's really important, and as Helen indicated, children are not the high risk group in terms of spreading the virus, but also when they do get the virus, they tend to have milder symptoms and milder disease. So it's really important that our focus is on those who are likely to get most unwell and suffer more from the virus, and how we then support our support services, our hospitals and our healthcare settings around caring for those and not being overwhelmed. So I think it is very much on the way for the wider population, and teachers will be included in those groups.
Thank you, Angela. And perhaps not surprisingly, we had quite a lot of questions about the vaccination programme. So I'm very much going to bring you back and ask you some more questions. And the first one is, how safe is it? And I've sort of split this question into 3. So how safe is it in general? How safe is it for severe allergy sufferers? And how safe is it for pregnant women? And these were all questions that we got asked for this evening's event.
Okay, so I'll try and cover those all individually. So we know that all of the vaccines that have been approved so far, so the Oxford AstraZeneca vaccine, the Pfizer-BioNTech vaccine and the Moderna vaccine have all been through rigorous trials and have been approved for use in the UK by the MHRA, and that's really important to understand, and they would only be approved if they were safe to be used, and they have gone through extensive trials. And as we're vaccinating people now, we're also continuing to gather information about the vaccines, and we are not seeing significant adverse events and issues arising as more and more of the population are being vaccinated. They are very safe. The trial data confirms that, and we shouldn't have a concern. And I think if you get your letter, highly recommend that you take up your vaccine. In terms of severe allergies, so there's very few groups that there is any contraindication to taking any of the vaccines. In the very early stages, as the Pfizer vaccine was being rolled out, there were a couple of adverse events which caused concern, but there's been ongoing review and scrutiny of events as people are having the vaccine. And so whilst initially there was some caution around people with severe allergies receiving the vaccines, those cautions are no longer required. So really the only people who shouldn't have the vaccine are those who have either had a previous, a really severe anaphylactic reaction to a previous dose of the vaccine. So as we move into second doses, if somebody had a severe reaction, then they shouldn't have the vaccine the second time, but also people who've had severe reactions to any of the components or ingredients within the vaccine. So it's really important before people come, particularly if they have got allergies, that they have had the information, and they can get that on the government websites. There's lots of information if you Google about the vaccines that will tell you the ingredients and what the contents are. And so very, very few people who it would not be safe to have the vaccine. The issue around pregnant women, and that's constantly being reviewed. And I think the important thing is there is no evidence to say it's not safe for women who are pregnant, who are considering becoming pregnant, and also for those who are breastfeeding. However, the trials didn't include those groups. So that's where there has been some degree of caution around pregnancy and the vaccine. So there is evidence from other studies that there are no known risks of giving inactivated or recombinant or bacterial vaccines during pregnancy. However, it is considered that there is insufficient evidence to recommend routine vaccination, routine use of the COVID-19 vaccination during pregnancy. And so what's advised by the Joint Committee for Vaccination and Immunisations is that vaccination in pregnancy should be considered. However, where there's a risk of exposure to COVID is high and can't be avoided, or where there are concerns for the health and well-being of the woman with, say, for example, if they have underlying conditions, which might put them at higher risk of complications. So we recommend that they discuss with their doctor if they're in that position, and any concerns prior to having the vaccination.
Thank you, Angela. That was really comprehensive. Thank you. Dr. Mohammed, I wonder if I can ask you about how effective the vaccine is, and particularly against some of these new variants that we're seeing. And this was a question submitted by Irina Gandara Moral about that. Wondering if you could answer that for us.
Yeah, definitely. More than happy to. So again, just to echo the safety aspect, I've had the vaccine myself. I've got my next jab coming up next week. Really excited and looking forward to it, having scrutinized the data. And we're probably going to come on to it a little bit more, but some people do have concerns, and again, the breadth of people that received the vaccine in the trial included Black people. So one of them, about 10% of the recruitments were Black. So it is safe for a wide range of people. So I just wanted to echo that as well. Specifically, the question about the variants. So at present, there are about 7 variants in the UK which are of concern and are currently under investigation. And the short answer is it's too early to say whether the vaccine, how effective the vaccine is against those. The current stance from the Chief Medical Officer is that, while the vaccines are currently being deployed in the UK, while they do appear to work well against the variants dominant in the UK, it's too early to speculate and be able to say how well they're going to be against future variants. However, that said, this is something that we're prepared for, and the companies are already working to adapt different vaccines to prepare us for those future variants. So the main thing is, if you get offered the vaccine, go ahead and get it.
Thank you, Dr. Mohammed. And that actually leads quite nicely into a question from Jean Barrow, which was around whether we're happy that we're reaching all parts of the community for vaccination. And Helen, I wonder if you could come in on that one.
Yes, happy to, Hayley. So building on Angela's description earlier, so as we know, it's been a very successful programme. We've had, and myself, I've worked around immunisation, vaccination for many years, as I'm sure Angela has, and we've never seen such good uptake figures. I can certainly say that just for seasonal flu, if we had the uptake figures we've currently got for the COVID vaccines, we'd be very, very happy. So really good uptake. We're seeing, as the cohorts are rolled out, well over 90% for each of the different cohort groups, and really good progress being made. So obviously, as Angela said, the JCVI, Joint Committee for Vaccination and Immunisation, set out the cohorts to ensure that the people that were most at risk from getting serious illness or dying vaccinated first. But of course, within that group, there are population groups that we need to actually do more targeted work. And that's what we're doing in Portsmouth. So even though we've got really good uptake, we have ensured that we've gone over and above to actually target some of our most risk populations. So ahead of actually the JCVI updating around learning disabilities and our homeless population as an example, we were in the programme targeting and doing outreach to ensure that our LD community, learning disabilities community, who we know have a 6 times higher likelihood of death if they get seriously ill with COVID. So really important that we identify those population groups. And we've also been working really well in partnership, I can say, with Solent, so Angela's organisation, but also with our homeless health team, so our local GPs working in that team, and also actually the fire service. So the fire service, as well as many people might know, have actually been running the vaccination programme, working with Solent in Basingstoke Fire Station and offering vaccine. They actually lent us one of their vans, so that we've been going out and actually, as well as doing our hostel homeless residents, we've actually been going out to offer vaccination to our street homeless residents. We have got a high population of homeless, particularly street homeless, and in our hostels in Portsmouth compared to many other local authority areas. And we've had really good uptake actually in this group. So they've been going out once a week to identify people and offer them vaccine and undertake that. But we've also, you'll be aware from the national media, that we have got that our BAME community are also at higher risk from COVID, from serious illness, and there's been some really good coverage of that. So we're also working with our mosques locally and hoping to do some pop-up vaccination clinics there to actually encourage people in a trusted community with trusted community leaders who can actually work with us. So again, really focusing around where we would call our inequalities to actually get better uptake in some of those community groups. Thank you, Hayley.
Thank you, and you sort of already touched on this, but one of the questions from Jenny Steigel was whether we think we're going to hit our numbers for the vaccination programme, and Angela, I wonder if you could come in on that, and whether you think by July the 31st all adults in Portsmouth will be vaccinated.
So as I alluded to earlier, the vaccination programme is going really extremely well at the moment. We're working through the cohorts. We're currently vaccinating the over 60s. We're looking to move into the last 2 cohorts over the next couple of weeks. So hopefully people in Portsmouth who are 55 and over will start to receive their letters inviting them for vaccine next week. And then we hope to move on to the over 50s within the next week or 2 after that. So on that basis, I think we very much will be on target to hit those outcomes, and that's really positive and really important for us to continue to do that. And I think just to reinforce Helen's message there is that you know, the vaccine programme through either the PCN, so the GPs, and through the large vaccine centres are only a part of a much bigger picture around how we reach our wider population groups, and so it's really important that we work together to achieve that.
That's brilliant, thank you. So we're coming towards the end of the event for this evening, and I want to finish on a really positive question, and I'd really like to thank those who submitted this. We had three actually, that were very similar. And it was more about what effect the pandemic has had on our city and what opportunities are there as a result. And I'd like to ask all the panelists this. So Helen, I'll come to you first, and from a Portsmouth City Council perspective.
Thank you, Hayley. So one of the huge strengths, I think, of Portsmouth is how well partners work together. So, I mean, tonight's a good example of that. You have got representatives here from the council, from the police, and from our NHS colleagues. And I think what's been positive through COVID, which has been a very difficult time, has been actually how well all of the partners have worked together to actually protect and support residents in Portsmouth. And for me, that's the most important thing. And coming as we move out, hopefully, I think what I'd like to see is that this continues, and perhaps we can start to refocus on other areas of inequalities. What COVID has shown us is that there are huge inequalities in this country, and people who do less well in people in deprived communities have suffered more from COVID, whether physically, from the health consequences, mentally, emotionally, and also in terms of jobs and income. So really important that we really focus on if we can continue to work in partnership, to focus on how we tackle those inequalities together.
Absolutely, I couldn't agree more, Helen. Councillor Winnington, would you like to add anything?
Yes, thank you. It's similar thing to really shown how Portsmouth is such a strong community in and of itself. But it's I think like nowhere else in the country, it really cares about its neighbours, and more than ever before, people in the city have got to know their neighbours better. They've been helping their neighbours, people in their wider community, and the amount of people volunteering has been unprecedented. It has really been magnificent. The amount of people who stepped up, given their own time to support other members of the community in both their local neighbourhoods and in the city as a whole, and it's been magnificent. So, and I think that's something that we can really make the most of, because the city, organisations in the city, especially in the voluntary and community sector, always need volunteers. There's always things that people can help out with in their local communities, and just keep an eye out for each other. And I think people have got the bug to do that now, and they found out that they really enjoyed it. But also the people who maybe in the past have thought, I'm really backwards of asking for help, I think they now understand that they can rely on their fellow citizens of the city to really help them out and give support. So I think that's a great opportunity for us, and out of what has been an unbelievably difficult time, that's a real positive for me.
Yeah, it's such a lovely thing to see, isn't it, when people help each other. Superintendent Jenkins.
Thank you. Yes, so I actually started as district commander in the city amid the pandemic. I think it was November I started, and I was struck immediately by two things. Firstly, the sense of community within the city, and the work that had gone into protecting vulnerable people, in particular via the Hive and other outlets that have come together to really work well to both identify those people who may be vulnerable and alone and need support, and then deliver a service to them. So that's been so encouraging to see, and then the work that we've done in partnership to identify vulnerability as well, and that hidden harm. And I suppose one thing that we should touch on through, you know, lockdown in particular, is there are people that have suffered at home as a consequence, and particular incidents around domestic abuse, for example, are things that concern us. But we've been able to put some really good campaigns across the partnership in place, with some really useful ways of reaching out to people when they might have touch points, with help and support numbers for them to contact and to be able to seek that help that they might need. And we've had some really good outcomes in relation to things such as drug supply within the city as well. I suppose it's sad to say that during lockdown, maybe that area of criminality stands out more when there's less visible, you know, less people out and about in the city. And again, that's really come through information that's shared with us through people that have a genuine desire to improve the quality of life in the city, and to you know, make people generally feel safer. So I think there's a lot to celebrate about what we've been through so far, and hopefully when we get to the new normal, we can all celebrate some more.
Thank you, Superintendent Jenkins. And Dr. Mohammed, from an NHS perspective.
There we go. Yeah, thanks so much for asking the question. It's really positive to see that people are taking a real interest in their own health and well-being, and being quite proactive about that, whether that's people asking about what vitamins they should be on. You know, there's been a lot of information about vitamin D and perhaps how many people are vitamin D deficient. People are getting out once a day for their brisk walk, and they've just sort of made that part of their habits and their routine, and they're Am I still there? There we go. If they're able to keep up some of those healthy activities post-pandemic, that'll be fantastic as well. And the other thing is, it's really catapulted our use of technology within the NHS, saving our patients time, you know, sending us pictures of your skin problems, having video consultations. And, you know, I'm conscious that it isn't for everyone, so we want to make sure that people aren't left behind. So again, that is another opportunity for development, to make sure this sort of technology is available for everyone, and so that we can all, you know, move forward in the right direction.
Absolutely, and pretty perfect that when you talk about technology, we have that slight glitch there,
Exactly.
but I think was probably the first one of the evening, hopefully. But Angela, I will finish with you.
Hello, thank you, and thank you everybody. I would keep it brief really, and just reiterate what my colleagues have said about the community spirit and how everybody has worked together in partnership. But I would like to specifically focus on how we as an organisation, and me as a professional working in this environment, have experienced the absolute delight of working with our partners in terms of our voluntary sector and our volunteers. I see it day in, day out in our vaccination centres, and particular thanks to Portsmouth Hive for all of the hard work and support that they have done to help us to get where we are. I've talked about the success of the vaccine programme, and that wouldn't be possible without that support, and we are indebted to you. But what I hope that does is give us the opportunity going forward, because it's always been there. We haven't always necessarily enabled things to happen, and I hope this will be the first step in really promoting that relationship of partnership across all sectors and all communities. So I'm excited for the future, so thank you.
Thank you, Angela, and to all of your colleagues in the NHS. And I think that seems like the perfect way to end the panel this evening. Thank you so much to all of our panelists. Thank you to our guests and to everybody who submitted questions for the event tonight. As I mentioned at the beginning, if we didn't answer your question tonight, we have got a full list of them, and we will be going back to everybody with answers to your questions. So if we didn't get around to it, we will email you. And if you've got any questions about COVID-19 in Portsmouth, visit the council website, portsmouth.gov.uk/COVID, and you'll get all the information. that you want there. So thank you very much. It's been a pleasure to have you. I hope you've enjoyed it, and we will see you again soon. Thank you.